Hi, I'm Neha Matthews, and you're listening to Three Things, the Indian Express news show.
India reported 704 coronavirus cases and 28 deaths in the last 24 hours, the biggest rise so far. With this, the number of infections has risen to 4,281 at the time of this recording, including 111 deaths, according to the Health Ministry. On today's episode, we'll talk about new innovations in testing and about domestic abuse cases rising globally. But first, how India is expanding its testing strategy. Amid the growth of cases of novel corona disease, states have started to look at rapid antibody tests, also known as serological or blood tests. The ICMR recently released an advisory for states to start using these rapid antibody tests in hotspots and in large migration gatherings or evacuee centers. Abantika Ghosh, who reports on health for the Indian Express Bureau and has been covering the coronavirus pandemic extensively, joins me now to discuss how these tests differ from RT PCR tests, which are used to diagnose COVID-19, and what the intention behind using them is. So recently we've been hearing about a new type of test, which is a rapid antibodies test or a serological test. Now, this is something Kerala had started using a few days ago, I think, with permission from the ICMR. Could you explain to our listeners what it is and how it differs from the COVID test?
So this is a rapid test, as the name suggests. It tests for the normal COVID test that we have been talking about, the RT PCR test, that tests for the virus. It's a two-step process. It identifies the virus. The rapid test, which is a serological test, identifies the antibodies in your body to the virus. So basically, it analyzes the response to the virus. It detects that since you have the weapons in your body to fight this virus, this means you have been invaded by the virus. So that's the serological test. And, there are several differences. Obviously, the first thing is it's faster. You can get a result in 15 to 30 minutes. Then for RT-PCR, that time is up to 8 to 9 hours because we have two tests. The first is a test where we identify the family, where we say that, yes, this is a coronavirus, one of 8 or 9 coronaviruses that we know. And the second test says that, yes, this is a coronavirus and it is the novel coronavirus, the one that we are calling SARS-CoV-2. So it's a two-step process. It's lengthier. It requires more expensive kits. So all of that. And this is cheaper. This is faster. It's easier.
But this serological test, would it be used to diagnose COVID-19?
That is a slightly tricky area because from the very beginning, ICMR has maintained that this is not to be used for diagnosis because, see, your body gets the virus. If at all your body is going to fight it or will be able to fight it, which is the case in maximum cases, 80-90% people do fight it back. But if at all that is going to happen, your body needs some amount of time to identify the virus, to see what will incapacitate it and all that. During that time, the virus is in your body and you are still spreading the infection. So even if you're tested then, you will test negative. But if you're around, if you're not in lockdown, if you're not in quarantine, you would be spreading the disease. So that is why in terms of diagnosis, this is a much delayed diagnosis. So it doesn't effectively serve our purpose of limiting the spread of the disease. That is why ICMR has been against it. But now they have said that in areas where there are clusters being reported in the containment zones, which we have been talking about for a few days now, which will be sealed off, large number of cases in one place. In fact, in Delhi, that sealing off has already happened in Nizamuddin. If you go to Nizamuddin now, you can't even drive through that road. You have to go from the other side. That's how the sealing has happened. This is also in the large migration gatherings and evacuee centers and all that, where you need rapid tests and rapid decisions. You don't have the time for those 8 to 9 hours to wait. So here, what ICMR has said is that if required, you can confirm with an RT-PCR. But if the antibody test is negative, then you confirm. But if the RT-PCR is not done, then if it's positive, then the person should be sent into home quarantine and the test repeated after 10 days. So after 10 days, if the person shows that it's negative, then it's fine. That person can go around and that person has been cured.
We know that this rapid testing also, it may not work in the first few days of the infection. What is the reason for that?
Yeah, that's because your body needs a little time with the antigen to decide what works. what are the vulnerable areas of the virus that need to be attacked, which antibody works.
And we know that asymptomatic people could also be carrying the coronavirus. Could they also be tested with this rapid testing?
See, the advisory that ICMR has issued is very open-ended. So essentially, it says symptomatic patients of influenza-like illnesses and all that. But essentially, it is the decision of the person on the ground, the decision makers on the ground. Normally, the advisory doesn't say asymptomatic people should be tested. But see, there is already in our testing strategy, even with RT PCR, there is a provision for testing asymptomatic people between 5 and 14 days of exposure. That is already there. That if you have come in contact but you're asymptomatic, you should be tested once. This is essentially a decision of the states, how to go about it, whether to do it or not. The states and the field workers, the decision makers in the field, who will have to think about rational use of kits also and what is sort of best return for investment, for want of a better word.
And you mentioned states are using it. We knew that Kerala had been using it for a while now. Are there other states that have followed suit?
I think Maharashtra has announced that they will use. I suppose they would be starting sometime this week. In fact, nationally also we should be starting this week. Tamil Nadu had asked for permission. Chhattisgarh had asked for permission. But I suppose now that this advisory is in, they will still need to approach ICMR, I suppose. But the process has been eased now. They can go ahead and do their tests if they have the kits and everything else.
But when this Tamil Nadu chief secretary went to the ICMR, what was their response to him?
No, at that point of time, all of this had not happened. In fact, even for this advisory to come, I am told there was quite a lot of to and fro in the government, that there were a lot of very heated meetings in ICMR before this came. Between the interim advisory and this final advisory, there were 2 whole days. And the interim advisory also was actually taken down that night itself. So there were a lot of misgivings within ICMR also on this. There were differences of opinion. So at the point of time when Tamil Nadu approached, none of this had happened. So I don't think they were allowed. But now I think the situation changes.
You mentioned that there will be, say, these serological tests and this rapid testing will take place in perhaps a hotspot like Nizamuddin. So what would be the purpose of them testing in these hotspots?
In hotspots, there are lots of cases. There's a lot of spread. So you essentially want to put as many people sort of inside their homes or inside the quarantine facility as possible to limit the spread. So now you can't sort of wait those 8-9 hours, or you may not even have the resources. That's also much more expensive. What you want to do is just quickly see whether you've been exposed. You have been exposed. Please go home and stay at home, because anyway you are staying at home. You just sort of know who all have been exposed, who are the people you need to look out for, whose contacts. So all of this will happen very quickly. So as you've seen throughout these couple of months of COVID, everything has happened, everything has changed. You know, the morning developments have changed the night. So we are getting figures twice a day. It's that rapid. That's why you have to contain it as fast as possible. You can't wait. That is the purpose.
When it comes to broadening testing categories and methods, one state in India has been outperforming the rest, Kerala. The state has broadened who it will test for COVID-19, was the first to seek permission to start antibody blood tests to check community transmission, and has now come up with an innovative model for testing, kiosk tests. Vishnu Verma, our Kerala correspondent, joins me now to talk about these developments and why widening their use across India may come with many advantages. So, Vishnu, in Ernakulam district in Kerala, the State Health Department has unveiled this new model. It's a walk-in sample kiosk model for testing. Could you describe to our listeners what this process looks like, who all can take this test?
Yes, basically the walk-in sample kiosk model, which is called WISK, has been engineered by a team of doctors and health officials of Ernakulam district in Kerala. And they've sort of taken the inspiration from the South Korean testing model of drive-through testing, where basically people in cars come into a certain locality and they get tested at the spot, and then they receive the results the day later. Sort of drawing inspiration from that model, the health officials have come up with this model. It's called the WISK model. So basically, it's a cabin. It is covered on all 3 sides. It has a glass screen in the front. So the person who has to get tested will sit in front of the glass, the screen outside, and the health worker, he or she can go inside, and she has to first put on the hand sanitizer, clean her hands, and then put on a pair of surgical gloves. And then on the glass screen, there are two openings through which there are two rubber gloves that have been attached. So the health worker, after cleaning her hands, can put her hands through the rubber gloves, and she can basically take the test without wearing a PPE kit, without wearing a protective personal equipment kit. So there is absolutely no physical interaction between the health worker and the person who's getting tested. It's absolutely safe, and it also requires very little time. Within 2 minutes, the entire sample can be taken. And after each sample is taken, a sanitation worker comes and cleans the gloves. Basically, he sprays disinfectant on the gloves as well as the chair on which the person's at. So there's absolutely no sort of health risk involved in this kind of a sample collection. So such kiosks can be set up temporarily at the local level in a ward or a panchayat or a corporation level, and people from nearby localities can actually come and get tested. Whoever is describing symptoms of the novel coronavirus or any viral infection basically can get tested.
And this would speed up the process of sample taking, but not necessarily the process of the testing, right? That still depends on the test kits.
Yes, absolutely. Yes.
And is this kiosk model limited to, say, just this place in Ernakulam, or is it still in the trial process will be sent to other places as well?
Yeah, so it's in a trial process. Each of these kiosks cost about $40,000. And basically, the advantage of the whole model is that the health worker who's taking the sample can take it anywhere, not just at a hospital. And plus, he or she doesn't have to wear a PPE kit. Because as doctors have repeatedly told us that every time a sample is taken, the health worker has to don the PPE kit and then has to be disposed after the sample is taken, which leads to a lot of these PPE kits being expended very quickly. So this is a very good solution to that. Not only can you save a lot of PPE kits through this way, there's also a very safe and very affordable way of collecting samples, and it doesn't have to be taken at hospitals. So right now it's in the trial phase. The health officials want people to come forward and basically fund these kiosks, because each of them cost about $40,000, and it's not rational for the health department to set these up. So if anyone can come forward and fund these kind of kiosks in their own local areas, that would be a really successful sort of an experiment.
So are they hoping that with this testing, if this model is used more widely, we'd have healthcare workers perhaps at district levels as well using this to collect samples and not just specific to hospitals?
Absolutely. I think this is a way of decentralizing the system. Instead of restricting the sample collection method to just hospitals, you're actually bringing that outside the hospital, where patients can actually come somewhere near their homes. They can come to a particular panchayat office, or it could be anywhere, and just get tested very fast. And so the health officials want to take the test for both PCR as well as the rapid antibody testing, the two kinds of testing that's currently available. So both of them can be done through this method.
And you mentioned this rapid antibody test. Now, Kerala was one of the first states to take permission from the ICMR to conduct this rapid antibody test or the serological test. Who do they plan on using it for, and what is the purpose of this testing?
Yes, so Kerala was the first state to get permission from the ICMR to do these tests. So far, they've been asking for the test kits, and they have to come from Hong Kong. And till date, we don't have information of the rapid test kits having arrived. But when they arrive, I think the health department is actually planning to use them in the hotspot areas. So Kerala currently has 7 districts which have been designated as hotspot areas. And the health department would be actually trying to use these rapid antibody tests on people who may have primary contact with a COVID infected patient, or someone who has foreign travel history but is not showing symptoms, basically. Basically, these tests would be very beneficial to health department workers to detect infection in asymptomatic patients. So I think that's what they're looking for.
I also wanted to ask you now, on an earlier episode of Three Things, we had talked about the RT PCR kits which diagnose COVID-19 infections, and specifically from MyLab, which is a diagnostic firm in Pune. So they were the first Indian company to manufacture these, indigenously, and the advantage is that they give results in, say, 2.5 hours. Now, we know that several states have placed the order for these MyLab kits, but has Kerala now become the first state to receive these kits and plan to start using them?
Yes, actually, Kerala did become the first state. Just 2-3 days ago, we got the RT PCR kits, which are basically reverse transcription PCR test kits manufactured by MyLab from Pune, thanks to Thiruvananthapuram MP and Congress leader Shashi Tharoor, who had placed the orders. So he had allotted around 57 lakhs from his MP-led funds to place orders for these test kits from my lab. And I think it was his way of negotiation and obviously the contacts that he has with the diagnostics company that has now been successful in getting the test kits. So a total of 3,000 RT PCR test kits have been ordered, out of which the first batch of 1,000 has reached the state, and it's already being in use in the MP's own constituency of Trivandrum, which is also a hotspot area. And the second batch of 2,000 has also arrived in the state. It arrived yesterday. They plan to use that soon because it helps in getting faster results.
And can you also explain who these tests will be used on, and are they specific to just Trivandrum right now?
The first batch of 1,000 test kits would ideally be used in Trivandrum. Trivandrum is a special case because of a patient who died last week here. So this is a 68-year-old man who was in a very critical condition, and he's barely spent 2 days in the hospital. He was on ventilator. So his was a special case because he had no foreign travel history or any known contact with an infected patient. So which made health officials very worried about where he got the infection from. After he died, the entire panchayat in which he lived, they were put under quarantine. A lot of people who may have come in contact with him have been put under quarantine. A couple of people who were his family members have also now tested positive. So I think they plan to use the RT-PCR test kits on people around that area because that's a very sensitive area now, reporting a lot of infections. So I think that's where the health department plans to use them. Also, the next batch of another test kits would ideally be used in Kasaragod, the northernmost district, which has reported the most number of infections. There are more than 100 positive cases of coronavirus there. So I think they would be used there as well.
Just to wrap up, I wanted to ask you now, are we seeing Kerala shifting a little away from the traditional testing strategy that the ICMR had laid out? Are we expanding the testing categories, since you mentioned hotspots are being tested as well?
Yes, absolutely. Kerala is expanding the testing model. From the very initial days when the first 3 coronavirus cases arrived from Wuhan in China, Kerala had started off on a very high testing model. But then in between, they revised the testing protocol to say that people with mild symptoms should stay at home and not come to the hospital because they wanted to release the pressure on the public hospitals. But now that we've seen in the last 1 week, we've seen the number of cases dwindle in Kerala because the health department sort of realizes that it has been able to contain the infection. So now it wants to ensure that there is absolutely no risk of community transmission. The chief minister said that he now plans to test people even with 1 or 2 symptoms. Earlier, only people with 4 or 5 symptoms of suspected symptoms of COVID-19 were tested. But now they would actually include more people with 1 or 2 symptoms as well, just 1 or 2 symptoms to get tested. So that sort of expands the entire testing protocol over a larger number of people and would help them to try to detect if there is any evidence of community spread.
UN Secretary General Antonio Guterres on Monday appealed governments to pay attention to and prevent a horrifying global surge in domestic violence over the last few weeks amid lockdown measures imposed by several countries to tackle the coronavirus pandemic. Now we will be doing a longer segment on this in future episodes, but till then, a quick roundup about how countries across the globe are reporting an increase in domestic abuse. Last week, the French government said that since lockdown measures were announced in the country, the number of domestic violence reports made to the police have gone up by 36% in Paris and 32% in the rest of the country, including 2 murders. Reports show that while fewer women called helplines than usual, the number of instant messages to aid organizations had gone up, suggesting that perpetrators could be preventing their victims from reporting incidents via phone. The French government subsequently announced an additional €1 million to fund relief organizations working against domestic abuse to help them cater to an increased number of requests for help. It has also promised to open up pop-up counseling centers and pay for hotel rooms for domestic violence victims. Victims have also been encouraged to seek help at pharmacies discreetly. In Italy, the government has launched an app that enables domestic violence victims to seek help without making a phone call. A proposal to allocate €4 million for shelters for victims is also being considered, according to an NBC report. In the UK, since the lockdown has started, the National Domestic Abuse Helpline saw a 25% rise in calls and online requests for help, according to a BBC report. The helpline's website had 150% more views compared to the last week of February. In India too, the National Commission for Women flagged the issue of a spike in cases of domestic violence since the enforcement of the national lockdown. NCW chief Rekha Sharma has said that the number of domestic violence cases must be much higher, but the women are scared to complain due to constant presence of their abusers at home. Sharma said that from March 24th till April 1st, the NCW has received 69 domestic violence complaints, and they are increasing by the day.
You were listening to Three Things by the Indian Express. Today's show, as always, was edited and mixed by our producer, Joshua Thomas. If you like the show, then do subscribe to us wherever you get your podcasts. You can also recommend the show to someone you think will like it. Share with a friend or someone in your family. It's the best way for people to get to know about us. You can also tweet us at Express Audio and write to us at podcasts@indianexpress.com.